Right now in California, the current amount of cases for COVID-19 is over 200,000. The current amount of deaths is over 5,800. California's Department of Public Health page for statewide updates shows there's an increase in both positive cases for 2.5% of an increase and deaths for 1.4% as of today, June 26, 2020. The CDPH's update page is listed on California's government website and lists statistics and data statewide. Data is then broken down into each county of California, and each county lists how many cases have progressed as well as number of hospitalized patients. The site also lists cases based on demographics such as age, gender, or ethnicity. All data provided by the state uses Tableau, an analytics platform for CDPH's daily updates and statistics. Personally, I believe California's lockdown policies are benefiting the state's residents more than it's hurting them. My mentality is based on even knowing that there's evidence that shows how much mental health is hurting right now. Physical health is also just as important, if not more important. The evidence shows that loneliness can deteriorate mental health, but as COVID-19 is, as you know, a respiratory issue, it mostly affects the elderly and immunocompromised. Normally, nothing will be able to get done if we don't protect those people, if we don't wear our masks or socially distance or do everything that we're supposed to do as told by the state. Even still, it's easy for anyone to be seen as a risk, because even I got tested for COVID-19 because I was having breathing issues, and they treat patients way differently. You're set up in a tent and you're just isolated from everyone else. They don't want you touching anything. You have to sit and wait, and they shove a swab up your nose. It's not a fun time, but I'm lucky that I didn't have COVID-19. Even if I'm still following the rules, it doesn't mean everyone else is. There's still so many people that I see walking around in counties near me just not wearing masks or not even socially distancing properly. Not everyone's going to follow the rules. It's hard because this is still such a top priority to protect people who need the protection. Even though cases are still spiking, it doesn't mean that we're going to stop anytime soon. What we do know is while cases are spiking, there's also a spike in suicides in many homes as we continue these lockdown stay-at-home orders. So right now, it's really just a battle of mental health versus physical health. So while I do feel that mental health is important, we are currently dealing with a highly infectious virus that's still spiking in the United States, and it hasn't shown signs of stopping. So that's why I feel that physical health does take a precedence. As COVID-19 cases had arisen when a county had decided to open too hastily, it only caused more problems than solutions. From Fox News, in an article titled "Coronavirus Cases in Northern California County Cause Officials to Backpedal on Reopening Plans," reporter Madeline Farber states Humboldt County and Sonoma County, for instance, have decelerated reopening after seeing a spike in cases, the Associated Press reported. Now, while this did occur a month ago, it still holds up since cases continue to increase in the entire state of California. And as Governor Newsom allowed rural counties to start opening earlier, troubles did occur with reopening, as stated in the previous article. More than likely, people rushed to return to daily life, so in turn, cases of novel coronavirus surfaced again. This leads to more cases made than reduced, thus slowing down the reopening process and moving on to the next stage. People in the state are already anxious to get back to normal, so when you're told, yes, you can go get a haircut, and then suddenly, no, you can't go get a haircut, it messes people up and it causes a lot more anguish and harm than what would happen if we just said don't get a haircut in the first place. As I mentioned in my main idea, mental health is also a big factor in quarantine and stay-at-home orders. In an article for the Washington Examiner, author Andrew Mark Miller quotes Dr. Michael DeBoisblanc of John Muir Medical Center, who says he's seen a year's worth of suicides in the last 4 weeks alone. While I do advocate for some form of important stay-at-home orders to be kept in place. The mental health of people in quarantine, it can't be ignored. The study from the report shows that the stress caused by quarantine has done some serious damage to people's mentalities. Restrictions for citizens should still be in place, but the limits from these restrictions should be given enough room to avoid a spike in cases and just enough to get people out of an isolated mindset. It should still be said, however, that people should continue to wear masks, socially distance, and self-isolate themselves as much as they possibly can. Now, it may come as a surprise, but California is no stranger to the coronavirus outbreak within the state. In a report posted in 2015, specialist Mahtab Shakarami states, as of May 7, 2015, MERS-CoV had not been detected in California. However, MERS-CoV poses a potential threat to global public health because MERS cases continue to be reported in Saudi Arabia and the reservoir for the virus remains unclear, although camels have been implicated in disease transmission. CDPH has established a coordinated statewide system working with local partners to identify potential MERS cases in California travelers returning from MERS-affected regions and their contacts. So, back in 2013 and 2014, the CDPH took great precautions to stop the potential spreading of MERS-CoV, or Middle East Respiratory Syndrome coronavirus, by isolated testing and testing on anyone that could be a suspected patient. With COVID-19, it seems as though some people want to avoid these precautions, a total change from back then. MERS-CoV wasn't a big issue in the States, but it was still treated as if it posed a threat and could affect anyone in the United States. On the other hand, COVID-19 wasn't treated like it was such a big issue until it was a much larger problem than it could be handled. This created more infections than finding out who was infected where and isolating problems at the source. As our closer, let's look at an article posted today that goes over Governor Gavin Newsom's plans for California and other states creating stricter restrictions from a surge of positive cases of COVID-19. Currently, the plan is to not push anything back and continue pushing towards reopening. Other officials like Andrew Neumer at UC Irvine and George Rutherford at UC San Francisco point out that we will pay the price for reopening, leading to more cases. Newsom combats this by citing how prepared that the state is for this. Cases are, however, monitored on more of a county basis because the state has implemented a watch list that places higher risk counties that have seen no progress in coronavirus cases, only seeing an increase in positive cases, and just have trouble maintaining their cases in general. From the article, health reporter Victoria Colliver says Newsom has emphasized that counties control their reopening plans and shifted power to local officials. That stands in contrast to the earliest months of the pandemic when Newsom was calling most of the shots for California's nearly 40 million residents. This is extremely important since California is very diverse regionally. More urban counties like Los Angeles County face more harm done with swift reopenings when compared to more rural counties like Trinity County, which has seen only 2 positive cases last time I checked the data. In the article, Carl Guardino, head of Silicon Valley Leadership Group, said it will be crippling in different ways on people's economic health as well as their health in other ways, as he fears more abuse in homes and stress would manifest in their residents. This ties back into my earlier statement talking about how mental health is deteriorating with stricter lockdown restrictions. Hopefully, Governor Newsom will continue to defer to counties and their own public officials in order to offer the best kind of attention for each county in the state of California. Thank you so much for taking the time to listen to this. Thank you, Sherry Sizzler, for making this project. I had a really fun time doing it, and happy summer.